Welcome to Thrive with Pride by AgeOptions, an inclusive online space for LGBT plus older adults and those who care for them. This is a recording of a live event held on Zoom, which included a Q&A segment that was not recorded. Do you want your healthcare to be less one-size-fits-all and more tailored? To be more affirming and inclusive for LGBTQIA plus people, and reflect how our communities have unique health experiences and face different barriers? This month, we welcomed PRIDEnet to explore these questions, what they are doing to catalyze LGBTQIA health research, share results from their recent community listening sessions with LGBTQIA plus older adults, and ways to get involved. Please see the video description below for a PDF of the slides and other helpful resources.
With you today, Cassie is a femboy snack enthusiast, MAPA, to a book-loving 3-year-old and currently living and loving in Chicago. Cassie is a connector and listener who still writes letters and calls people on the phone, and is only funny when they aren't trying. They are a collector of tiny things and will never say no to a karaoke invite. Cassie loves listening to and uplifting LGBTQIA+ people's stories, and is passionate about improving healthcare and access for LGBTQIA+ people. So without further ado, I will toss it over to you. Cassie, thanks so much for joining us today.
Thank you, Nina. And thank you all so much for inviting me to join you today. I'm excited to try to keep this brief so we can have a lot of time for discussion and I can hear from you all. Today, I'm going to be talking with you all about LGBTQI+ health research and sharing results back from our community listening sessions that we recently completed with LGBTQI+ older adults. There we go. Stella is also joining us, not for the presentation, because we're going to try to keep it brief and get through and save a lot of time for discussion. But Stella worked with us along with other amazing staff from Equitas Health on the community listening sessions and has a lot of valuable insight and was present for the sessions that we did. And so we'll be able to bring a lot of insights to those discussions and more perspectives than me. So we're very excited to have Stella, who's also a public health specialist with the Master's in Public Health from Ohio, and currently is the Research and Evaluation Associate for Equitas Health. Just a little bit for our agenda today. We did our round robins. We're going to briefly just talk about getting on the same page about what is health research and what do we mean when we say that term. Why is it important that LGBTQI+ people be involved in health research, and a little bit about the work that we do at PRIDEnet. And then we're going to go in a little bit more depth into our community listening sessions that we recently completed, and we'll close out by talking about ways that you can get involved. And then we'll leave plenty of time for discussion and question and answers. And then we'll wrap up. Nina and AgeOptions staff will come back on for announcements. As Stella mentioned, she'll also be monitoring the chat. We'll be putting links in to follow along with the presentation and monitoring questions so we can save those for the end. So to get us all on the same page, we're just talking about what is health research. So health research is also sometimes called medical research, and its goal is to learn more about human health and well-being. This research often, or the goal, if it's achieved, is to help us find better ways to treat and prevent disease. Typically, people volunteer to participate by answering survey questions or sometimes by testing new medications or surgical procedures, for example. There are lots of different kinds of health research. Some of them we'll talk about today, like genetic research and research databases. But the approach that PRIDEnet takes, and that we're going to spend a little bit more time talking about, is called community engaged research, which is an approach to research that centers trust and transparency and relationship building. It's one that acknowledges and recognizes the expertise of the community members that you're doing research with, and aims to ensure that that research is relevant and responsive to the community needs. And this is really important for LGBTQI+ communities because we've often experienced discrimination in healthcare, at society at large. And there's also been a lot of research studies that have stigmatized LGBTQI plus people. And so community engaged research is helping to change that. And it's helping to make sure that the findings are easily available to you, to make sure that the findings are easily available to healthcare professionals, to policymakers, and to the broader LGBTQI plus community and advocates working for change. This in turn helps create greater awareness around how to best support LGBTQI plus people, and input from the community and research participants when we work together helps make this happen. So why is it important that LGBTQI plus people be involved in health research? Well, in most health studies, even larger studies like the US Census, researchers do not collect data about sexual orientation and gender identity. And the result means that when it comes to LGBTQI plus people, there's a lack of understanding and a gap in knowledge about how our full identities affect our health and well-being. And this plays a role in why healthcare can be less inclusive for LGBTQI plus people, why there are fewer resources tailored to the needs of our specific communities. And to address the information gaps, organizations like PRIDEnet and the National Institutes of Health are partnering with LGBTQI plus communities to conduct health research and to make sure that's done in that person-centered approach. So make sure that that's done in that community-engaged health research approach, which allows participants to be involved in all stages of the process, which in turn helps healthcare professionals and policymakers and community advocates better understand how our distinct identities, challenges, and successes affect our individual and communal well-being. And this is a quote that I really like from our former PRIDEnet ambassador, Jamison Green, who said, "When you take away someone's healthcare, you take away their humanity. And I'm sick and tired of that. I want to see this research done, and I want us to be empowered by that research. I believe we can do it together." And that is what PRIDEnet also believes. This is me with my teammates that are a part of our community engagement team. We're based out of Stanford University, and we're a national network of LGBTQI plus serving organizations who are working together to increase LGBTQI plus participation in health research studies. So we're trying to close that gap in knowledge that I was talking about. One way we can address that gap is through creating opportunities for ways that you can participate in health research, and also opportunities for you to help provide input to all stages of that research process. There are lots of other ways that PRIDEnet partners with community to receive feedback. We have a participant advisory committee, a group of ambassadors. We have a community partner consortium. We do a lot of digital engagement to help reach across the US. And we've also done over 30 plus listening sessions, one of which we'll be talking more in depth about with you all today. Just a shout out to our amazing participant advisory committee. I wanted to share this with you all. These are also our incredible advisors. These teams do an incredible amount of work, and we just love partnering with them. And these are also, you can see some of the logos from some of our community partner consortium members that are across the US, including Equitas Health, who is here with us today, and who partnered with us to do our community listening sessions with LGBTQI plus adults 50 years and older. And we're going to talk now. There's so much great information in this report, and hopefully we'll be able to even dive more into discussion. But we can't get through everything. So if you want to be able to follow along, you can see the full report. It's available at pridenet.org/reports, and Stella can put that link in the chat if you all want to pull it up. We collaborated with Equitas Health from the very beginning, all the way through the end, including dissemination, which is why we're here together to co-present and tell you about this report. We did a total of 3 community listening sessions. They were 2 hours in length. We asked folks open-ended questions in those sessions. A total of 38 participants joined across all 3 sessions. I also put a QR code to link the report, if that might be easier for you if you have a smartphone or another device that has a camera. You can scan it over this QR code, and it'll pop up a yellow link. If you click on that, it'll pull open the full report. But also Stella put the link in the chat. So we asked a lot of open-ended questions to participants about their health concerns and solutions, about their experience participating in health research, about their experiences of aging, about the importance of social support and community building. And we got a lot of amazing conversations and discussions. We had a total of 7 different themes come up and emerge that are, and these are the themes that make up our report. And instead of really just barely scratching the surface about all 7 of these, I thought it would be better that we could spend some of our time digging a little bit deeper. So I'm going to launch a poll for you all to just tell me what are your, out of these 7 themes, what are the top 3 that you want to hear more about? And we'll see how many we can get through in the time frame we've allotted for this section. And we can also go back if folks want in the discussion. So I'm going to launch a poll. It should show up on your screen, and you will be able to select multiple choice style, just your top 3. So those options are to hear more about what our participants had to say about community health concerns and solutions. You could hear more about what participants had to say about health research attitudes and experiences, or information sharing, community building, and social support. You could also hear more about experiences of aging in social environments. Participants also shared about their fears and concerns around aging, their experiences with advocacy, and also their experiences and thoughts around the joy of aging. And it looks like 71 for 85%. Looks like maybe one more person. If you haven't voted yet and you want to, yay. Okay. Everyone voted. I love it. Let me jot down these results real quickly. It looks like most people want to hear about experiences of aging in social environments. And then followed by, ooh, a triple tie between research attitudes, info sharing, community building, and fears and concerns. So we'll start with the information sharing. I'll share those results so you all can see. Don't think I just made that up. All right. So I'm going to jump forward to slides. Sorry, I'm going to go do this quickly, so it might look really fast on your screen. I'm just going to jump ahead to social experiences of aging in social environments. Okay, so many session participant in this topic, this theme that arose, many session participants really talked about feeling marginalized within the broader LGBTQI plus community due to their age and experiencing pressure to conceal signs of aging. Some participants stated that aging really needs to be more normalized and discussed more in the LGBTQI plus community in a positive and affirming way. And a lot of participants felt that normalizing aging could also help LGBTQI plus people learn what to expect as they age and allow information to be shared with those who need it. This is a long quote and it might look small on your screen, so I'll read it aloud. I really liked this quote. So this is a participant who said, I think there's an expectation that we're just going to go off in a corner and just, just kind of do it, meaning age, and not bother anybody. But, I've always been out and I'm not about to go back into the closet as an older gay man. That's just not going to happen. And, I'm aging out loud, It's just like, I'm not going to hide this. You're going to see this happen. And I think the more that we are able to talk about that, the better off we're going to be. Because, there's all this mystery about it. I'm finding out half the things that they said about aging just aren't true, just in terms of, well, some of them are. Let me put it that way. But still, it's just being able to talk about aging and it being an affirming and positive conversation, as opposed to it being a negative or something that people have to whisper about. So that was one of the quotes from one person. A lot of participants really agreed with this and brought things up. Another perspective that a participant brought up that we talked about under this theme of aging in social environments. This participant shares, I find that attitudes about aging in the Black community and the gay community are two very different things. In the gay community, it's like, oh, you're aging and you're, I don't want to say washed up, but they pretty much kind of treat me like I'm irrelevant. But in the Black community, I'm revered. I'm an elder. I'm seen as wise. I don't think I'm all that wise, but I'll let them think that. It's a very different experience. So there's a, I don't want to say a conflict, but I can guarantee you that I'm going to pay more attention to where I'm being revered than where I'm getting ostracized. And this came up with some other participants who had other marginalized identities describing the contrasting experience of feeling revered and respected for their age in those specific communities while facing a sense of insignificance in the broader LGBTQI plus community. So a lot of the quotes and things that were shared around this theme were about this. Okay, I'm going to go back a little bit to share. Folks wanted to know about health research attitudes and experiences. We'll dive in a little bit here. So a lot of participants expressed really feeling positive about engaging in health research. People noted the following benefits about like gaining a new perspective, increasing representation in their community, contributing to knowledge that would help future generations of LGBTQI plus people. And people also really expressed a desire for more comprehensive studies that prioritize diversity as well as like a larger number of participants. Some participants were like disappointed or expressed that there was like a scarcity of information or opportunities for involvement in research, like not being able to find out about them very easily, and instances where they were deemed ineligible due to their age or pre-existing health conditions. So that was really frustrating for a lot of participants. Some participants also raised concerns about engaging in health research. The concerns are mostly around confidentiality, equitable presentation, and distribution of findings. So like when you get this information, people weren't sure if they could trust how are you going to present it and what are you going to do with it? Is it going to be manipulated? So people really wanted to see transparency and clarity of research findings in terms of wanting to know more about the research framework to address any hesitations before they got more involved. And these are just two quotes I pulled up here. One, I almost think like participating in research is one of the elements of resilience for me. It helps me feel like I'm contributing to knowledge about trans and queer people, which I hope means that in the end, there'll be greater human rights for queer and trans people. And then another quote from a different participant who said, I have a friend who just won't participate in anything related to LGBTQ health because he's so afraid of confidentiality. There's histories of people being harmed by research efforts, not just with their confidential information being shared. So I think those histories, I think those are histories that we need to continue to reckon. There was a sub-theme that emerged. A lot of participants talked a lot about language and terminology. Within talking about research experiences specifically. So, and there was a lot of, this is a kind of a really, even though it's a sub-theme, it's a pretty robust section of the report because there were really a lot of mixed reactions and opinions. A lot of people expressed generational differences. Some people felt offended by terms used by younger generations, while others felt really rendered invisible because terms that they used to use have fallen out of context or use and are now considered offensive, even though they use them for themselves. There were also participants who talked about terms related to culture and race and or ethnicity identity terms, which also vary by culture and generation as well. And a lot of people really just suggested that researchers address these language concerns by making sure they're collaborating really closely with the community being studied to determine the language that will really resonate with them. And then as this as this quote exemplifies, one session participant explained how they felt excluded by the language that researchers used. So they said, when I read those studies and what's in them, just by the wording, it feels like they're geared towards younger people as opposed to people our age or my age. And they'll say it's an open study for any age, but the way they structure their sentences and the words they use, it reads as though it's for a much younger population. So just a lot of really great information for researchers to really consider. I know folks also wanted to hear more about information sharing, community building, social support, and also fears around aging. The information, community building, and social support is a pretty robust area, and I know we're also kind of running out of time on this section, so I'll just I won't read the quotes, but I'll briefly just share a little bit about some of the information sharing. We asked session participants how they wanted to see their communities represented in photos or images used in outreach materials. We also asked them about the importance of community-based social support services to their aging experiences, both formal, like through community centers, social services, health services programming, and then in informal ways, like with their chosen family, their friends, their neighbors. And overall, social support, both formal and informal, were discussed as crucial to their overall health and well-being. And if people want in the discussion, we can kind of dive back into these, but I want to make sure we have plenty of time for discussion. So I'm going to move on to talk just a little bit about some of the recommendations that came out. So apologize if this is going fastly through your screen. I'll let you know when I get to the recommendations page. Okay. So there were a total of 7 recommendations based on all of those themes and everything that was shared. We worked those into 7 recommendations informed by different experiences and advice and solutions that participants in the session shared. So the first, and these are just summaries, there's a lot more details in the report. The first one was to make sure that LGBTQ plus older adults are really involved from the onset. So at every stage of that research process, during the design phase, throughout the process, and in the dissemination of the findings. Our second recommendation was around all the information we really got about recruitment and outreach, which was around using realistic and diverse images. Some specifics were that representation should not be overly sexualized, but it should also not be void of sexuality. Assets should have large print options if they're being like a paper, physical print option. In addition to digital, and then again, information about the eligibility and the research goal should be clearly stated from the beginning to address any of those hesitations or concerns. Our third recommendation is around familiarizing yourself with the terminology and the discourse around language in the community that you're working with. Our fourth recommendation was really based on some really specific examples that individuals shared around programming and social support. So some specific recommendations that participants gave were to offer a mixture of in-person and online activities, to allocate more resources to improving outreach to LGBTQI plus aging adults of color, as well as those in rural areas, to not make any assumptions about older adults' ability and interest in using technology. While there were participants who said technology is a barrier for them, there were also a lot of other participants who said they actively use technology, especially to build community and stay connected. So it's important to offer training and technical assistance, but do not assume that digital options should not be included or considered. And then specific in programming that they said they enjoyed were intergenerational groups, mentorship opportunities, and programming on topics such as combating loneliness or isolation, building and maintaining relationships, sexuality and sexual health for older adults, transitions like moving or retirement, and memory loss. So they gave a lot of really great specific recommendations, and even more of that can be found in the report. Our last recommendations, there was a pretty robust section around the need for healthcare providers and community organizations to better educate themselves on HIV with a particular focus on the health impacts of long-term survivorship. And there was a lot around considering having flexible age-based eligibility based on this. There were a lot of really specific examples given around the barriers for not just research participation, but also for participating in programming, social services, and in healthcare. And so there's a lot of information in the report about what those barriers are, as well as suggestions for how to address those. And so there's a lot of great information around the recommendation of that. And then our last recommendation was just that there's so much great information in here that could really be built upon for future research studies, delving into understanding those barriers, but also for research efforts to highlight the resilience and positive contributions of this community. Promising avenues for further investigation, we thought, included the joys of aging highlighted by session participants in this report. All right, so that was a very quick and fast summary of this really amazing report. And I'm just going to move into this last section of the presentation. I'm just a smidge over time, but I'll only take a few more minutes just so you can talk about how you can get involved. So if you're interested in becoming more involved in closing those gaps and increasing the representation of LGBTQI plus people in health research, I'm going to just briefly talk about how you can do that. Here's a quote from one of our current PRIDEnet ambassadors, Donald M. Bell, who said, LGBTQI plus health research can help make things better for the future. And for those of us who are here now, it's how we leave a legacy. And I really love this quote also because I feel like it's one of the reasons that I'm involved in health research. As Nina said in my introduction, I'm the MAPA of a 3-year-old, and just really who also has a lot of young people in their lives who are part of the LGBTQI plus community, and just wanting to make things better for generation is one of the reasons that I'm involved now. And so I really like that quote. There are 2 different studies that you can participate in if you'd like to, that could help increase the representation of LGBTQI plus people. And there's also benefits for you individually in participating. Those are the All of Us Research Program and the PRIDE study. Still, if you don't mind putting those links in the chat in case people want to learn more or enroll in either one of these studies. I'm going to talk more about them just a little bit. The National Institutes of Health All of Us Research Program is a really historic effort to gather data from 1 million or more people living in the United States to help accelerate health research and improve health through creating the largest biomedical database. We're going to talk a little bit more about what that means. The second study is called the PRIDE study, which is the first large-scale long-term national health study designed to better understand the needs of LGBTQI plus people specifically. And unlike traditional research studies, both of these studies are building research databases. So instead of looking at a specific disease or a specific group of people, these studies are creating a diverse data set that allow researchers to conduct thousands of studies at one time on a variety of health topics. So it's really helping to accelerate what we know about LGBTQI plus health. So the PRIDE study is our in-house study. It's operated through PRIDEnet through Stanford University, and it's all online. You don't go in anywhere. It's longitudinal, which means you have an opportunity to take one survey online once a year for as many years as you want to be a part of the survey. Benefits include what I mentioned in the beginning. If you participate now, over time, those contributions can help to contribute to research that will help improve the health of LGBTQI plus people. And also, because the LGBTQI plus community isn't a monolith, I'm sure you're a part of lots of other communities that could be underrepresented in health research. And we want to make sure that when we're talking about elevating and making representation of all LGBTQI plus people. So if you're involved now, you can also help ensure that the communities you're a part of are represented in the data. As a participant, you'll be the first to know about research outcomes and how they affect your communities. We've already published over 61 publications on a range of topics. Those are all on our webpage. And there's community-friendly summaries that are one page and written in plain, easy to understand language. And there's also incentive opportunities. For the All of Us Research Program, this is the second opportunity that you can be involved in. This is really focusing more on that clinical and biomedical research. So because a lot of people, including LGBTQIA plus people, have been left out of this type of research, we have less tailored healthcare and less information about our experiences. So the All of Us Research is really trying to change that by pushing forward precision medicine, which means breaking out of this one-size-fits-all medical approach. By studying data from diverse groups of people, researchers can learn more about what makes people sick and keeps them healthy. And it takes into account how to understand how lifestyle, genetics, and environment affect the health of all people. But we want to make sure that LGBTQI plus people are a part of what is advancing the future of medicine and healthcare. So they have 3 goals. One of them is to nurture partnerships with participants. Like I said, they want to have 1 million participants enrolled, and they want to create one of the largest, richest biomedical databases. So they collect a lot of different information in addition to surveys. You can also share your genetic information. And then the third part of this program is that want to make sure that researchers and community members are doing something with all of this information and that we're advancing what we know about healthcare for LGBTQI plus people. But this study is also open to everyone. And the All of Us Research Program also gives a lot back to participants, including the ability to learn about your own health. So if you do give your genetic information, they give 3 results back to participants. You can have access to an ancestry report. You also get a pharmacogenetic report, which means it looks at how your specific genetic information interacts with the top prescribed prescription drug medications, whether you metabolize something faster or slower, or if there's multiple different types of drugs for a specific disease, which one might be better for you. And then you also get a hereditary disease risk report, which looks at the top hereditary disease in the United States and what your risk is to those. The program will also pay for any clinical confirmation of results that you get, and they also provide free genetic counseling to all participants to help you understand what those results mean. If you want to learn more about those studies, the links are in the chat. I'm also happy to answer questions. If you're not interested in studies at all, that's great. You can learn more about other ways to get involved through future community listening sessions when we have openings in our ambassador or participant advisory committee, when we have events online and across the US, including lots in Chicago. And you could sign up for our newsletter to do that. And I'll put that in the chat. You can also follow us online, and you can also contact me directly. My email is here. Just want to say a huge thank you to all the participants of our community listening session, to all the participants of the Pride Study and the All of Us Research Program, and a big shout out to Stella and the rest of the Equitas Health staff who made the community listening sessions possible and brilliant and beautiful. So thank you.
Thanks again to Cassie from PRIDEnet for joining us this month. Don't forget to check out the video description below for slides from their presentation and other helpful resources discussed during Q&A. We hope that you will join us again on September 24th when we welcome community health workers from the HAP Foundation to present Coping with Grief and Loss. Sign up for email reminders of future events at www.thrivingwithpride.org. Thanks for watching.